I'm Supervisor Zev Yaroslavsky, and I'm joined by Supervisor Mark Ridley Thomas, who will speak after me, and then Dr. Jonathan Fielding, the Director of the Department of Public Health, who will speak after Supervisor Ridley Thomas. Thank you for joining us this morning. It's great to see representatives here from community-based organizations and the County Public Health Department, who I know will be very pleased to hear what I am about to announce. Several months ago, the Public Health Department applied for grant funding from the United States Health and Human Services Communities Putting Prevention to Work initiative. The department and over 400 applicants from across the entire country have all vied for a portion of more than $378 million in federal stimulus dollars, which were to be made available across the country. At a time when public agencies across the nation are forced to cut back on their expenditures, and on outreach in particular due to the tough economic times, that money, the money that's being made available by the Department of Health and Human Services, represents an opportunity to expand life-changing, indeed life-saving programs. And so, as First Lady Michelle Obama is announcing in Washington, D.C. right now to a select small number of communities, it is with great pleasure that I can say that Los Angeles County won. The Los Angeles County Department of Public Health will receive an unprecedented $32 million in funding from this initiative. This money will be spent over the next 2 years on projects that will address obesity, physical activity, nutrition, tobacco use, and exposure to tobacco smoke. These projects will focus on making environmental changes that will positively impact an individual's access to safe places to exercise, their ability to purchase nutritious foods, and their right to a smoke-free living, working, and social environment. I just would add on the issue of obesity and tobacco, this is an epidemic. Obesity is an epidemic in our society. The rate of obesity has risen among adults by 22% over the last 10 years, and the statistics for school-age children is that 1 out of 4 school-age children in this community are obese. So clearly something needs to be done, and this will help us jumpstart the efforts to reduce obesity in our population. And 1 million people in this county smoke, believe it or not. Still, over 1 million people smoke. And it affects lower income persons more disproportionately than others, and people in minority communities more than others. And smoke is a killer. Tobacco is a killer. And side stream smoke, the secondhand smoke that the rest of us have to inhale when somebody smokes in our presence, is also a killer. So these 2 target areas will be profoundly impacted by this $32 million grant that we are receiving here in Los Angeles County today. So this funding gives our Public Health Department an exciting new opportunity to improve the health and the quality of life of all Los Angeles County residents. I want to congratulate the Department of Public Health for this impressive win for the residents of Los Angeles County. I want to acknowledge that the Board of Supervisors, all 5 of us, voted to make this application, fought hard to get to this day, and the good news isn't the $32 million. The good news is what we're going to be able to do with the $32 million, that we're going to be able to improve people's quality of lives, lengthen their days on this earth, and improve our economy, because nothing saps the resources of our health system across the country than tobacco-related diseases and obesity. And we've got to turn that trend around.